how common is hearing loss in adults?
Hearing loss is interesting because if you looked hard enough, we probably all have some degree of hearing loss. And the question just becomes, at what point is it causing you symptoms, and at what point would you really want to go and have it tested and have it checked out? We all lose hearing with age, and by age, I don't mean what people sometimes think, which is 70, 80, 90. We all lose hearing probably starting in our 20s or even our 30s, and we start to have these incremental decreases with age. And so it's one of those things that can affect almost anyone and probably does affect a large majority of our population to some degree.
So if we take a 20-year-old, 30-year-old that's beginning to lose some hearing, but they don't realize that, are there things that they can do to protect hearing loss being more aggressive?
Absolutely, yeah. So with age, and especially now in the era of earbuds and loud music and lots of loud music at concerts, what we recommend is that people think about that more often. And you don't have to wear earplugs all day, every day, but there are situations that you may not necessarily associate with a dangerous level of hearing loss that can be encountered in everyday life. And so we recommend people are really careful at concerts, air travel, when working with power tools, about wearing ear protection, and then just using common sense stuff like when you're using your earbud headphones, just find a volume that's comfortable but not necessarily loud in terms of the way you perceive it.
Even at my age, I've gone to some concerts and I come out and my ears are ringing and it lasts for 8, 10, 12 hours almost the next morning. Is that damaging my hearing?
It can be. So that's something called a temporary threshold shift, which is just doctor speak. But what that is your body's saying something was too loud, and so we've turned down the volume. And so for a couple of hours, sometimes even a couple of days, you can have this period where your ear is really kind of in the volume down mode because your body has reacted to that really loud, abrasive stimulus, and it's kind of shut all of the volume down for a little while. And so sometimes those can be permanent, but we also know that people that are having a lot of those temporary threshold shifts are probably more likely to have some long-term hearing damage from it.